Have you ever wondered why a healthy person can all of a sudden not be able to walk, talk, or even recognize the people she loved? Join me on today's episode and let's find out the answer to this question together. I welcome you all to today's episode on Health Matters. Indeed, your health really matters. On today's episode, we are having a conversation about stroke. And research has shown that stroke is the second leading cause of death and disability globally. And unfortunately, a lot of people do not have much information about the warning signs of stroke. On today's episode, we are having this conversation with Dr. Edu Jemfi. He is a medical officer at Kwesi Government Hospital. But before I introduce our special guest for today's session, I want you all, my lovely guests, to tap on the subscription box if you haven't subscribed to become part of this family. Like, share, and subscribe to all our social media platforms. Also, don't forget, I am in the person of Miss Inseidu, and I'm your host for today's episode. Join me as we welcome our special guest for today's episode. Dr. Edu, you're welcome.
Thank you very much.
It's really a great pleasure doing this with you.
It's a pleasure here too.
We are looking forward to having you more often on our
Right.
show. Before I come to you for us to start the conversation, I'd like to come to you, my lovely audience. Grab all your pens, your books, your tools, everything that you will need to put down some notes for further references later when you need them. Don't forget, we are still discussing stroke. I come to you, Dr. Edu.
All right.
You're welcome once again.
Thank you very much.
Just as I said in my introduction, many people do not have information about the warning signs of stroke.
Okay.
So my first question to you is, what is stroke, if we
All right.
talk about it?
Thank you very much for having me here this afternoon. But it was very hectic at work, but I have to find time to actually educate people. Because I believe when people are well educated and they know about their health, like they come into the hospital like that, like the numbers will reduce
Sure.
and all that, because like it's kind of now we are not having the numbers as we used to. But so it's all good to have me here. Okay, so when we talk about stroke, it's a neurological deficit that happens in the person, and it can be gradual or sudden onset. And when it happens like that, it can lead to, let's say, the death of a person, or let's say the impairment of the person's ability to walk or do some basic things later. The reason why I said it's after 24 hours is that if it happens within the 24 hours and a person recovers, that one we don't call it stroke. We call it TIA, transient ischemic attack. But after the 24 hours, if it continues, then it's stroke. And it can also, like, it can be sudden and the person can just go. The person can just die. Sometimes they will bring the people to the hospital, rushing. You check the BPs, the BPs are skyrocketing and all that. Just in a moment of time, the person is gone. Or sometimes they come, you ask them to go and do head CT to actually confirm. Before they come back, the person is gone. So it can be gradual or sudden and lead to the death of the person. Or after 24 hours, the person will leave, then it come with the complications thereafter. So it's a neurological deficit. It happens in the brain, not anywhere. It's in the brain. Yes, please. That's why we have the neurological. So neuro has to do with the brain, the nerves, the vessels, and all that. All right.
So now we've gotten to know that it's a neurological condition, so
Sure.
it's in our brain.
Sure.
And so we are not going to see the signs or how it's going to start from the brain. Thank you so much.
All right.
So my next question is, what are the different types of stroke?
Okay, so when we talk about different types, so with our education now, let's say we have basically two.
Okay.
We have the infarctive or ischemic stroke and then hemorrhagic stroke. So the ischemic or infarctive, let's say there's a vessel, how do you call, okay, let me take this. The brain, as we have it, my ability now to talk, to express, to be using my hands is as a result of a part of my brain which is working. getting the nutrient, getting the oxygen, getting the blood that it has to get. The blood carries the oxygen, so it's getting everything that it needs for it to work actively. So if there is a blockage to that part of the brain getting this blood or this nutrient that I'm even talking about, then there is a deficit. So when the deficit comes, the part of the brain that is affected, like that's what you see. I'm going to. So let's say with a ischemic, there is a block.
Okay.
The blood is not able to get to the target, that part of the brain that it has to get. Okay, that is ischemic. So there is a blockage. There is something that is causing the blood not to get to where it has to get to, and it will come with its own symptoms per the part of the brain that is affected. And we have the hemorrhagic. That one has to, when we say hemorrhagic, hemorrhage, it simply means bleeding. Do you understand? So the blood vessels, the brain vessels, the brain has its own blood vessels, and these blood vessels, they are very thin. They are not as bigger or as stronger than the ones you can see here. So any pressure that and it doesn't just come. It will come gradually, and it gets to its threshold. The tissue, or let's say the vessel, cannot have it, and it will just burst. We have arterial then venous, let's say junction. So sometimes there's an arterial venous malformation, like it will lead to aneurysm, something we call aneurysm. The brain, like the vessel will just open, it will just burst because of the pressure that the vessels cannot take. Then when it bursts, there's blood all over the part of the brain. And God, that's not how God made it. So it comes with its own complication, depending on the part of the brain that is being affected.
From the explanation of the stroke you gave, you made mention of TIA.
Yeah.
Is it also parts of the types or?
No. That one is just an attack. Just, let's say, a warning sign.
Okay.
I'm there. I'm coming. So that one is a transient ischemic. Remember we said with the types of stroke, we have ischemic. So it's transient. It's just, when we say something is transient, it's like I don't know how to say it. It just gradually slides. So it's kind of a warning sign that I'm there, like something is happening. That our body talk to us, but sometimes we neglect those calls or those warning signs. So it's a warning sign that, Charlie, like this is so watch out. So it's a transient. So it will tell you, then you have to be on the lookout. Then you check your health and all that. So it's a transient ischemic attack.
So the ischemic one has to do with a blockage.
A blockage. So oxygen, let's say, oxygen through blood through oxygen is not able to get to the parts of the brain.
Then the ischemic, the hemorrhagic one has to do with the
bleeding. Yes, a burst of the vessels.
So what causes stroke? What brings about it?
Okay, so let me take this. It's broader. So when we talk about the causes, or let's say the risk factors, we have the modifiable and the non-modifiable factors. When we talk about the modifiable, it's modifiable. You can do something about it. Simply that way, modifiable. You can do something about it. Non-modifiable, you can't. That's how it is. So when we talk about the modifiable, even with the modifiable, we have arterial cause and venous cause. But because of time, let's just take it all in one. So the modifiable, what you can do to help, or let's say what you do that brings the stroke. One, hypertension is one. Diabetes is one. We talk about, let's say, smoking, excessive alcohol, let's say hypercoagulability stage. If a woman is pregnant, their blood becomes very thick and all that. It's a factor. Sickle cell disease. Somebody who has sickle cell disease can get that. Let's say not hydrating dehydration. Because when you are dehydrated, your blood becomes very thick. The blood is not able to move very well. So when it goes on like that, sometimes the blood becomes clot. So the clot lodging somewhere, then throwing up to the part of the brain, it goes to cause a blockage there, and that one can also lead to stroke. We also have a, how do you call it, metabolic syndrome. Somebody who has hypertension, who has diabetes, who has dyslipidemia, let's say the lipids are very high, are deranged, plus central obesity. You look at the person is obese and all that, it can also lead to stroke. Then we talk about the non-modifiable. That one you can't do anything about it. Age, race, black. It's noted that we the blacks tend to have it more than then male. Sex male. Male tend to get it more than
I was about
females.
asking who
Why?
are the most people at risk of getting this condition.
So with the sex, when we talk with respect to the sex, it has to do with males more than females. So I'm saying these are the few factors. Infection can be part. Somebody getting sepsis and he throwing up and all that. DVT. Somebody having DVT, then the vessels, the vessels are kind of occluded with clots all over. So if it throws the clots, throws up, then gets to the brain, we tend to have it. Somebody having a malignancy, you understand? Let's say a malignancy has to, like at the lungs or wherever it is, then it throws up, ends up in the brain. The person can get stroke. So any neurological anything that will cause a deficit in the brain, like it's lab. Let me even say the syphilis. Sexual transmitted disease, syphilis. If you get syphilis, then we see it, we tell you, oh, you have to give you this medication. Some people, they just neglect, they go. But if you don't treat it, it has stages. It gets to that last stage, then it goes to your brain. You can also get stroke. So it's not all stroke that's as a result of diabetes, hypertension, dyslipidemia. No. Syphilis can also cause, and even some medications that we take unknowingly. Let me say with ladies, for instance, the pills, the contraceptive pills, some too, like abusing it too much can also lead to that.
But is it preventable? Like, can stroke be prevented?
Yes, so we have a risk factor. We have what got you there.
Okay.
Like me coming to this place, I drove here. So if I don't want to come here, I wouldn't come. I wouldn't drive. You understand? I would just park the car somewhere and wouldn't come. So we have the risk factors. So what got you there? The risk factors that we talk about. So if you find yourself in any of this, then you have to deal with this. You have hypertension. They've told you, you've put you on medications. You're not taking your medication. You are falling to some herbal. I'm not saying they are not good, but you know what? Now, when you go to some hospitals, let's say Few Quanta, for instance, when you go, they have the herbal unit.
Okay.
So when you go, you have hypertension. Okay, with me, I'm okay with the herbal. They will take you to the herbal doctor. Then he will look at your vital signs, then see the appropriate medication to give. Because for them, it's quantified. But with the other ones, they are not quantified. They can just give you a gallon, drink everything for the whole month. I mean, you all don't know the quantity that's going inside. But when you go to the places that is a herbal certified herbal doctor from, let's say UCC, KNUST, like they train them now. So that one, it's quantified. They know what to give. You have diabetes. They've put you on medication. Just take your medications. Visit your doctor or your physician anytime you have to go. Then you have lab that they take you through. Then you do all these things. If you drink alcohol excessively, you just have to reduce it. If you smoke, you just have to stop. And all this stuff, if you find yourself...
So can stress even lead to that?
Stress can lead to hypertension then.
It will also lead to...
Thank you.
Thank you so much. So what are some of the warning signs? Like,
So with the warning sign, let me say the fast is the warning sign.
Okay.
That acronym. Is a warning sign. And one, let me say the TIA is a warning sign. if you have the transient ischemic attack, you are there, that all of a sudden it's like you pass out, you can't move your limbs. Then later on, in a minute or two, or let's say an hour later, you come back. Do you understand? It's a warning sign. Okay, so let's take the fast. So with the fast, the F stands for facial.
Okay.
So you tend to have facial deviation, like I'm trying to talk, but my lips kind of going sideways. That's the facial deviation. Then you have the A, that is the arm. You tend to have limbs, not only your arms, so the upper and the lower limbs, weakness, like kind of you paralyzed, you can't actually move them very well, kind of flappy movement, like when you walk in, kind of you are being swayed. If I'm giving you something like you're shaking, you can't actually take it, your hand is falling up and all that. Then you come to the S, that is the speech. Have to do with the speech. The speech is not only the ability of the person talking, because you have the bronchi and the Wernicke part. Okay, let's go on. So with a speech, with a speech, you find out that the person is not able to, the voice is not able to come out very well, and even with the articulation of the sound, it's not properly as it used to be. You see that my mom of late now, the way she talks, even when she, like, we communicating, we saying A, she's saying B. You understand? So it means that part of the brain for cognition, for speech, is being impaired. Like the body is trying to communicate through the speech that is not coming very well, through the person not able to understand what you're actually talking about. It's actually telling us that there was something happening. Then we have the T. With the T, that was time. When you go to, let me say, for the foreign countries, when somebody has stroke, sees all these things, time, you just call the 991. Yes, it works perfectly. But our system, you know our system. So our system, with the timing, when you see these three signs, just rush to the hospital so that they just have you check earlier. Because here, for instance, I mostly tell people around me, Africa, or let me say Ghana here, you are your own hospital, you are your own health. Whatever it is, you have to be like, take your health as we use. Yes, we say something. Fande walk up, like cherish it, because our system kind of, we have lapses, and the lapses are much, such that sometimes a patient is there dying. You know that I need A, B, C, and this patient will survive, but you don't have it. You just be there, you do some one or two, then patient will be gone. Then so I always tell people, so with the timing, when you see these three, the F, the A, and the S, just rush. So time is of, when you go outside, the reason why they put the timing is that when it happens and you go very early, they will intervene with the appropriate medication, if they have to go inside the brain there and there, they will go quick. Because when you go, they have a CT machine there in the hospital, they have an MRI, quick. But in our jurisdiction, go to Ifekwanta, even our boss in this region,
you need to be transferred to another facility.
You see it. My facility, we don't have it. Sometimes they will come, you ask them you have to stabilize a bit. Then you ask them to go and take the CT. Then you see whatever is happening, the type of stroke. Because with the type, will tell you how you manage it. Because if it is ischemic, I have to go this way. If it's hemorrhage, I have to go this way. But when you go outside, the person will come quick. Everything is set. That's why they have the timing there. Because the timing is of an equivalent. So when they call and the paramedics even come, then they realize, they check one or two things, signs. They know, okay, it's this type. There in the ambulance, they start intervening. But our system, forget it. So our timing, when you see the three, just rush to the hospital.
Please, the timing is very important. And just like he's saying, sometimes the machines and all the necessary equipment may not be available. But he made mention of CT. I know of Gapua Hospital having one of the CT machines there. So in case of any emergency, then you are wondering where to go. you can rush there quickly, then they would help you out for you to save your mom, your dad, a brother or a sister, or even your loved one. The conversation is still ongoing. Don't forget to subscribe, like, share, and comment in our comment section. You can also bring in your contributions as well, and they will be greatly acknowledged. Back to you, Dr. Edu. While you were talking, you were like, timing and we shouldn't waste time. So it means this is in your field, you say a medical emergency.
Very true.
So why is it a medical emergency?
It's an emergency because if we delay in the management,
Okay.
it's kind of, let me say, stroke is kind of a progressive kind of condition.
Okay.
You see a patient right now in this state, the next hour you come and the person has retrogressed or has made a progress positively. So it's either the person is going forward doing well or going forward doing bad. So if you go to the teaching hospital, the bigger hospitals, when you have a stroke patient, their management, their checking of their vitals, sometimes it's done every 30 minutes or every hour. Because in every 30 minutes, every hour, when you come, I have to check all the neurological function. You understand? We have the CNS, like whether the speech, the person was not able to talk. How is the speech now? I have to look at the tones, the powers of the muscles and all that. So it's kind of a progressive stuff. Am I doing well or am I doing bad? So it's an emergency that when the person comes, like if you don't start intervening well, the person may come in good situation. The next minute, next hour, the person is going. That's why I say in our jurisdiction, we actually, people are dying of stroke, which sometimes the medical doctors, our hands are tied. There's nothing we can do. Unless, let's say, if Kolebu, even that one too, actually for them to give you some medications, something has to be, I mean,
financially.
there has to be, do you understand? And those medications are very, very expensive. That I might say our health insurance can't cover. So, but when you go outside, the timing, it's an emergency because it's an emergency because if the person becomes bad, the person can die, or the person can become worse off. Somebody who was actively moving, able to walk, able to drive, able to do everything by him or herself. But because of this thing that happens suddenly now, the person is not able to. The person has become, we have something we call vegetable. They are just there. For you to eat, somebody has to help you. For you to, like, even to walk from distance A to B, you need some assistance, or the way you have to drag your leg. Like, so outside, they know all this. That's why the time is of an essence to them. But in our jurisdiction, we will help you not to get to the worst. Okay. That's why we say it's an emergency.
This condition is really serious, and I'm hoping that my viewers would really make time to listen, and then not just listen. Just as last week, our dietitian made us aware, Dr. Tufo, he said, having the knowledge alone is not power, but knowledge and then you able to practice what you have heard is what actually gives you the power. Just this Sunday, I heard of a similar, I wouldn't say it's a stroke, but the way the scenario happened, the person was fine. All of a sudden, she stepped out to buy something. The moment she walked out of her room or the church, wherever that she was, she suddenly collapsed and then fell down. They rushed her to the hospital saying, "Nefa ajuju. Untum half." I was like, hey, just all of a sudden, this person that is fine and we are all talking to her just happened. So this shows us that it is really a matter that we have to pay much attention about. So please, do well to stay tuned to the very end of this conversation. Back to you, Dr. Edu. My next question is, what are some of the treatments available for stroke?
Okay, so with the treatment available, has to do with, the person used to have hypertension.
Okay.
And through that, the hypertension was poorly managed. The person would default the medication and all that. And as a result, it ended him or her in such. So when you come, you have to manage the pressures. Nti oba dema ne pressure no or dey yehwe there ye de beba foam kakra no foam kra because or o stay because obi ba with a bit the hemorrhagic stroke the upper gwadwen no ho a on ne pressure no ye kede systolic no esoze no onye dey obro 220 and acid no onye dey obro 120 nti say ne pressure no na onye dey ye de ba foam so kra in the pressure no class no between 180, 160, 170, 110 and 100 grand. Those people, it's okay. Though it's high, but it's okay because of what actually had happened. Because you need those pressures there. Those vessels now all or because of bleeding according to wonya moja papa no pressure near more they tend to have it. But if you drop it drastically, it means you are shutting down even those small collaterals now obebuan kakaka na ha. So for them, one pressure you maintain a bit high kakra, like you don't drop it all of a sudden. And with the ischemic, so it's to the same, like you target a range. There's a man and he say obesity so diabetes. You try to like how do you call it? Control the sugars. Yeah, so a control the sugars no. Now like the nipa no the sugar no or the on your the fasting or you okay. The how do you call it? The random no so obey okay. Then you look at the other stuff. So those are the treatments that we give. So treatment no now. We have the acute treatment. The Waba hospital no. Yebe man frama because adwene hia frama. And as this year or adwene yar. Ntode ye boa no kakra with inframa looking at the SpO2 no. Ebu okra beba no ne oxygen no wonu mu no okay but ode supporting kakra because of the condition na nipa kuno na ebe hwe so de ebe man insu like infusion through the veins and others obotum anoma ebe man but it shouldn't be too much na ebu also say ontumi noma ebu eman insu no eman eduru no ontumi noma odugu na nim harara dem nipa no say kodo aye ya eziban kama obotum nsu na eziban no obokọ ne lungs no ho no akofa different problem nti ono no dem na near the tube e dey ahye ne hwinim ne dey akọ ne efu no chede yes amane eduru obi also ontumi nantle near the rubber kakra e dey ahye ni behim ana baby also anchefa no near the ahye near the ama wotum we sanche ana other bed no do zonde other ho ontumi move nti 2 hours 2 hours libia no done down ebi mo ho wo ska ye wo bed bi wo ha either water shed either nsu wom or a mobile nti ono nipa no dado a onye no hwe ye damado na ama nature ekuru omba ho because ebi mo will develop bed sores ina ye nature hade no kasa bi wo hade nti dem kasa no se eda ho chera skin no or very thin. That place too is very like you have some capillaries there like in this the skin isn't all thin no, and it's against a hard surface being the bed no. Because about hospital some of the bed into all the hot chair them are pressure or heat alcohol na they will and this one na they be coho into all the skin become compromised into with time they want a why there time a bobo no it will slide. No one what skin or pull kakra. You have a kind of a bend. It's a bend. At the skin or peel of kakra. Until with time, the man want all your crew kesa or a big issue or a very 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 big. Indeed, I want them no. You down kakra na down now today. Now down now to new bone community fa down like. But when you go outside, they have a bed, almost one bed now for such stroke. They have a stroke unit. Their temperature is different. The bed that they sleep on is different. When it's bano with the BBI is different. Don't know that one. Oba wafa remote no bed no achan okay me go left. Bed now as I buy easy. Sometimes you have to call the relatives. A friend relative no abana. Obu oba soon. Now let's share. Let's see. So you understand why we say in our jurisdiction, like things are we are really lucky, but we are doing our best. Then you tend to with the nurses with the let's say the orderlies around. Sometimes they come to help, and the relatives to tend the patient. Now they will be also born a okosidama obi wɔ hɔ a ne yam otumi tim. Ne yam tim kra ontum onyɛ yi. Though didi but one ne yam tim. We also help give medication or be free in the bowels no. Because okawachala also there another serious stuff or the bar.
Aside in Drununa, this nursing
Okay.
Is there any other procedures
Oh yeah. When I remember I kind of approach you on timing. Until we were say or your moja and a word than brain no. Sometimes they will need a surgical intervention. Until you team no call theater no abo born or that so in the skull no I call baby a moja no watching if the person will become okay. Man is a man who be there. Time I made my house job or Cape Coast Teaching Hospital, we had a stroke patient. It was a bad hemorrhagic stroke, and was a neurosurgeon. We had a neurosurgeon at Cape Coast. So through his intervention with our team, on a surgeon, but I was in the internal medicine. So our physician specialist talk over obe share no. When you go theater, watching. Oh no. Making minka mfeinka na sika wo ho because papa no I remember him the no or takwa he works in the mines nanti na sika your problem so we went they did it they watching moja ni free or bear what the shant to what the bibi you find the tube beto a obe drain insu another moja kakaka or draining later on about review the man is okay like nothing has even happened he's okay. But Ngoniska, a better than I. So and aside the so medicine, Yemeni drew. You bet me a surgical intervention. Then physio. So we start physio very early. So we started physio very early because Nipano otum use nisa. Mean say me to move, but many stroke me to move. The muscles help in the movement with the nerves and all that. And right now, because there is an impediment to the brain, the part of the brain, the nerve center now, make it you move. Own one. The muscle no, lazy. So if the muscle becomes lazy, they become atrophied. Why the disuse of it? Epa men use. They be amenan to some way. A week or 2 or 3, you see me developing some. You want me nano or phone. Okay. Because I'm not using it, so it's a disuse of the muscle. They want in Pacono, Nana, or chuchu. So they do the physio to help the muscles not to intend a massage, one more exercise. Now they just to open up.
And them or send the signal ma adrene day. Oh, BB recordo.
Yes, and aside that adrenaline, so even the muscle also, so that the muscles won't be okay, like on your last dama. Why the enam your meat here? Say meat no. In your live animal, no chani meat. Anyway, what your meat no? Then your boy, you find the meat of a live animal and the meat of aboa yɛmfa meat a wɔatwa ato akyerɛ ɛhwɛ ebɔ na ɛkɔ wa shrink wa moa bɛkɔ so that was how it be. So with the physio now then it helps on my muscle even with the skeletal the musculoskeletal system so they doing it they are telling the musculoskeletal and they say you still have to they also send the signals to the brain.
So what are some of the long-term complications
Okay, so with the long-term complications, it's not easy. Depression is one. Okay. I used to be this, now I can't. I used to drive, now I can't drive. I'm a taxi driver, driving on a mizizi, because of yare me amazing, me koba, sisi amintum. So depression, I am bunch depression then let me say dementia. The part of the brain now, osi, with the part of man that cognitive memory near then if it happens there, the person become like there's a dementia. If we are family neglect, like if we are the person has lost hope, paralysis, onto me nan to be obikra nedwuma bon because if we are a driver, I don't know what you cars I can see a company see. This is your one into me, a better nature you lose your job. You see it. So long-term complications they make it let me say poverty. Yes.
Even with the speech now.
Even with the speech now, so or a speech name bar, but with the speech, most of them, no. So recover and kakra, like they go through the speech therapy now.
Okay.
Like they pick up.
So even with the treatment, they go through speech therapy
yes.
as well.
Okay. Oh yes. So being like if the speech center was affected, they go through. Yeah.
So my next question is, it's like I was about asking how does the stroke affect our speech and then our movement as well.
I think now there you have it. So it has to do with the part of the brain that is affected. So the brain or your bulk on part biya ne function will play in us. So if that part is affected, you have that symptom.
You made mention of depression. So which is each way and there yen ebusuya and adofo, they also do help in the healing of patients who has stroke.
I'm telling you, we need them. We actually need them. Financially, they being around, trying to motivate the person, like because it's not easy. Like I think now some of the hospitals, they try to get the psychologists as part of the DM and the hypertension clinics that some of them have, and even with the stroke patients. Sometimes when we ask them to come for review. You refer the person to go and see a psychologist. Then, even with the family, or take care of the sick person. It's not easy for the person because take it if it's a relative of yours. Nangsa first no okoba. Sisi on combo the ho. Obi are busy. Aye wejuma is or there wejuma na ye na den. EJ o maami bi o papa bi or there then ebe hwe no. Mirikin wejuma na ye no. It was bringing you income. Edi bi ma book akokre na abru na sisi na oda way. Untumi come. So you get it. So it's not easy for the person angsa when you stroke no. Onye easy and sana the family. Onye easy. Oh yeah, there. Other one on to me combo. It's not easy. It's not easy.
Welcome to you, Dr. Edu. On this juncture, I would like to encourage all people taking care of stroke patients. We feel what you are going through. Oh yes, one rehu baby or some so one our quan one in Juma na one dada nyoma away. Now so your best ezin ye ni name ma won so won abe mu se won abe mu bu a nipa ne healing no on bantem nti wonya gidi bi won nipa ne mu na yensi yembo an nkaka dem brado kleka na egwarum na ezizim ye be ye ne ho ye ne nyina obeye dadwen na so ye besre o me yenya won ho abotar na yemfa mbo ahwan kakra na wara enya condition mesre Mankasa nso mama wa bem embu nya enidado de obecherezi but with the treatment that your doctors and nurses are giving to you gradually obeye na waso ho ato basa ya anya ne dama obeye no babao but depression now was sets in after the stroke has been gone. We need to go in for another treatment for the depression and see a whole new cost on its own. It's a mystery. Young boy here na kasa yen ho na young boy wana worishwe here nanso. Back to you, Dr. Edu. So my next question is, what are some of the lifestyle changes stroke patients, one are waiting was survive, no, or said that way.
Okay, so lifestyle changing. The make adinenya na nyame adom. One call waste of it, that's to die, or even for you to just be in bed and to me yeshi and to me move. Na to me moving kakra. Wondru who stroke in drew like who beep in drew so who diabetes in drew was what they are more there fan. And they koda nefa na physio. And they koda a physio. And the physio one thing is now we have like social media. You go to YouTube. There are so many physio exercises free. Just look at them. Even in the house, you can do it yourself. Echo, some of the stores are the items that they use. You go to your physio, you know, before with the physio, on the back, it's starting now, or do what to that, but all the time when you have progressed, or in a week, once, and in 2 weeks, once. Days na enkono, outside wolf, you know. Now also a nowadays I see some stroke patients, some of them that I see, they are young people. You see them walking by the road, like at dawn, yeah, they're training, yeah. And I'll be asking, oh, if you had done this a long time, you wouldn't have gotten it. But it's all good because they recover very well. And them are making with the hairband. We have some of everyone who use hairband stuff for the year like they come back with their orthodox medication and they are more offer with there's you see them making improvement. And the people who make improvement, I catch that and men no men the person will go on and do it. Then it means you want to go early. You want to go early. And some of them is the depression that makes them to do that. Because the only come all year and some all year see on to me here. Indeed, let me just give up. So such people, some they come to your how do you call it, your consulting. When you are talking to them, you see that it's like they are kind of giving up on themselves. Then the man and you want to casa. Oh, all is not lost. Like it's one for some. You involve the family. No abba when any bidding come on, like the family to also help financial and because it's not easy. It's not easy. So with the lifestyle, no economy and no kwesi broni on a record you quantify because you have a quantity broni or calculate time or in a day. Separate no san no day. But yeah, the one day now. But as a stroke patient, they like it should be far off. Like once a while, be found, it's okay. But idea to muda, then you also check your diet. It's banana those you can say antioxidants.
Come on, I'll come so that you elaborate more
then
on it.
all that, and then with your physio, the family helping, then you taking your medication, you'll be okay. You'll be okay.
Mesri, say nyami na adom na ye recover nkakra. The things that we were doing before that led to us having the stroke. Please and please again, let's do all to stay away from them. Let's obey as asha senede, but nkakra. So one ko rinti menya obi mo boa wo. Ebusuafo wo ho adofo wo ho waka wo ho na etim aye ema wa aye. Oka ansano in the mesre ye youth no. And from our earlier way no, he made mention of contraceptive pills. We are trying to prevent teenage pregnancy or avoid ourselves from getting pregnant and have fun. It's true, but please, in as much as we want to have fun, we should be mindful of how often we use these contraceptive pills. Because in the game, ye the go, hooray. But it is going to lead us to a whole lot of conditions. So please, and please again, let's do well to desist from them. Back to you, Dr. You made mention of inzibanity. Inziban bit then na say yes ya obe buahin. I recover.
So it's one the make even I am crying your stroke no cry. It's also good for us.
Okay.
Yeah, veggies.
Okay.
It's like yam veggies. More na there like try and inculcate that habit of eat vegetables, your carrots, your cucumbers, your green, like those stuff. Nde Ghana hano, oh yeah, the main, oh yeah, no boys and kakra. But when you go outside, like I don't know, it's somewhere. Oh yeah,
For
yo,
them, they are developed and they are now
aha.
developing. So
Oh yeah, yo.
there's a
So
bit of
they have
difference.
all those. So with those vegetables, with our fruits, like the water that you take, the time that you eat. Menkere yen fufu na yen banku na yen na mutuo na. I'm not saying they are not good. They are very good. But the time is busy. Ebezi no be 9. I bet no TV ho. And I tena we kita wo phone. Kum. Ada. And it's continuous. Ombwa. But isn't in term be 6, 5, 7 what I your own maybe by 9, 10, 11 recorder. It's okay. So you just check on our diet, what you eat, and at what time. And I don't do such a like you are not helping the system. And then we also have to exercise. Exercise in a week, if you can do with 3 times or 2 times or like three times or 4 times or try and do something. Well, I saw through one panel do na crown or in your bedroom no crown. You can be stretching 5 minutes and 10 minutes. You can do something. Now, the gyms have, you can buy your gym, you can buy
Just
your gym.
bring yours at your own
That
house.
is it, at your
Create
own house,
own.
skipping. Daniel Oza and the compound house or compound. You can do skipping. Even skipping every day for let's say 5 minutes. You skip at that wall, a stretch. It's all form of exercising. You do all these things. But when we are in your stroke, no, unknown to me, but with the little over to my ear, they have balls that they use. Then you use it, then you exercise. You be better. At least you stay longer. You stay very long. So them you can ezibano with our vegetables, with the fruits. I know in ezibano using, but the time although heavy. Today is in term not with too much digest in term now. So me that was what I would say. And yeah, vegetables now. Young contumely garden like they're all good. They're all good. Tomatoes, the raw one. But since you are now, all our foods are
No bono.
genetic modified and all
No
that.
bono.
And I'm ufiempo or backyard. You can do some small backyard farm. On the more natural. One son I want BBM. Yeah, those ones you can do with them. You eat raw tomatoes, garden eggs, they are all good. Yeah.
So what are some of the recent treatments in stroke? It's promising that there's this likelihood, even though it's expensive.
Yes.
There's the likelihood.
Yeah, it's the money. It's the money, and it's so unfortunate our insurance can't do much. It's so unfortunate our insurance, but I believe gradually we will get there. So with a treatment in the on surgery we have medications that we give. Oba se bibi like moje bi na wada adwene ho a we can do the CT, we can trace where it is near the tube shema ko baby a blockage no moja no wada no na de edru no was afima ntokowa na edru na wana no na wa disperse no they go to the system, it work perfectly. Say oye moja wabo egu adwene no ho a oba intentem na wako we do the bare holes, something we call bare, why the air drill. So it's kind of a drill. So you drill to the part of the brain why then they get the blood out, then you do the little correction. Person is okay, but it all has to do with money. Yeah, because people get stroke, let's say in Ghana here, if the person is very rich and they're able to fly the person quick. No, say even that within 6 years I'm experiencing something. Me I momiska chartered flight to UK quick. When I'm drawn temp chartered, I'll be fine. I'll come back very healthy. So it's like that. I know there have been rumors about some politicians getting stroke, then going outside for obeying there. Like, yes. So that tells you we can, but ondru ha. Like I think UG, University of Ghana Medical Center, they have all those, but it all has to do with the money. If you don't have it, you know, like health, but health is expensive.
That one is
When you
very
go outside,
expensive.
yes, and we don't understand. Health is expensive in that how you wear, if something gets you there, if you
Take luxury of time before you
and that luxury time is what
money.
Aha. So don't let us get there. Don't get there. So
So please, to you, my lovely viewers, ni nyinaa yɛreka no sɛ ebetim na a survivor sikasam ɛka ho. Nti wei deɛ mɛsere, ɛyɛ mafoto kakra a medze bɛma me nuanom a maaso meka ho bi afei na yɛresi do. Ma ɔka yɛ a ɔbɛduru dɛ yɛhia sika no ntam a yɛnya na yɛmfa mboa yɛn ayaresa nti. Let's try and then, as we are now growing, grow this habit of investing and then saving little by little. We should do emergency trust funds. Yen fan to ho say a start a juma who sika kakra baban oh a month may save it 20 cedis, may save it 10 cedis, 1 cedi, 50 pesos. Before you realize it has really grown into a huge sum of money that can be of help. But if we are to wait, then the exact day, pull the entire money out. Even if you are bringing it out itself, because of the quantity or the amount you are taking. Let's say, be in the I don't see a whole problem. It is a no mamma na yam papa no when ye be my yehu and I win tim one ya. Yana birthday. Technology has made it quite easier for us to put certain measures in place in order to save ourselves and the future generations ahead of us. As I've said, you have the information, but if we do not practice them, it is still going to be the same. So please, let's do all to practice what we've heard. Do all to subscribe, share, and like as well. We are about to draw the curtains down for today's discussion. So my last but one question to you, Dr. Edu, is there are a lot of misconceptions about stroke. Like, a bit more say, oh, yeah, in your no another,
on the what can be our neighbor. Oh, may she share what's a drew to then we would tell them, okay, what to do. But see, them know why. In town, won't quiet one whom is no 9 years, yeah, what we never would know. So these are some of the misconceptions. The thing you know, you have BP. And let me say this, with hypertension, we should already be friend opportunistic test or checks. O baby yare, o mommy be yare, o sister be yare, o new be yare, and in the call hospital. And in the call hospital, and there or BP machine be take opportunity. That's what we call the opportunistic test. Take that opportunity. One check two, no. And one thing is, most of the times when we go, they check one and we're okay. Let them check the two. Go to my low waha. It can be high here. Why it is high? I want to know the right. What kind of BP? I check or so. Then okay, well, come doctor. Now check. Yeah, check. They still. They come okay. And remember we do CCR. Your checks from them and they year we ha needs no be ba na ebe bisa nebo asem esifie ne maami bi ne papa bi ne nua bi wakem ma like awerɛho yɛyɛw anaa obi wɔ hɔ wenya asɛm bi like ɔredwendwen nti ne nda adwen na nsa yɛ stable nti ehu dem nipa no ɛfa ɛne ne kasa you like rule out all these factors. Okay, bibi nsi wo fie bibi de but BP now also na okay I would go check for bare 2 weeks and 1 week na fabra na menhwe ndi echo check no ebu ebe catch up but every check we no wuti pa no ye rush bra hospital another any pharmacy like echo no check no was so pa bra na yenhwe then you do it. So you check it, you come, then we strike the average. Okay, averagely is this. You don't need medication now. And also, okay, averagely is still high. Okay, on the quiet them labs, because when you kidney issues, because if and there when you BP, but when you BP no, whoever saw one go further, and bisa abezintra ne BP no wakosoro. Because everyone BP no wakosoro because the person is getting, let's say, a kidney issue. Another person has thyroid. BP like something. BP no okoching BP oba. Ntebo BP na basoro or a young person or a day have to do some labs. I'm a BP profile but still high. More labs be na share ni kidney, share ni liver, share ni lipid level, share all these things so that you know that oh okay, no wakoching BP na ba, no wakoching yaba. You don't just jump. It's very high that you help to bring it down. Then even when you bring it down, you check why. You don't just leave it like that. But some then later when they want a when your kidney issue. Because the BP going up, no, sometimes it's the kidney sending the signal. The kidney sending the signal. And then when they check, there was a young guy obey. I think he was 39. The BPs were very high. I said, no, okay, your check is still high. Your gene talk we are maintaining. No, oil labs obey the kidneys, the creatinine level had gone high, the uric acid had gone high. And when I more coffee quanta dialysis or started 1, 2, it's okay because oil acute. Osia nintone hu nintema de babaka na hin bibi dem no ke man ndru na o chede de
the real cause is there.
Is there into ebe hu ni bi ebe hu no adwum be ka obi na adwum be ka obe ye you know
why escalate, why it too late.
Why too late? So we have to take opportunity. Na ye those mates there or your bonsam yareba or ye we don't go with it. You count it. So your bonsam yareba our any ba I'll call it soon na ye name was
Mercury. When were the days that we were thinking stroke can affect only elderly people? It doesn't only affect them.
Very true.
Even people as young as myself, it can happen to us. Yet you know a nyama or attack. Oye different bibi na ori kodo umfum bibi na kodo wa adwin ni mu. Ide de moja enkwa adwin ni ho ye. Nti obendem a oxygen adwin ni hia no oye kiti bi. Nti dem no nerves a wo ye na adwin ma odi information bebre he no. Wonti me nye won adwuma na wa ama ye nya stroke. Nti onye honhom maze. Mema ye ndada ye ho ana ye ma obi endada he. De oye honhom aze. Betima ye obiara na mesre contraceptive pills no we say na body biom and the cigarette smoking and the wine na the na alcohol na ye num ni nyinara ye hwe na ye ntewodo na onye mpanyimfo nko mafamanso we are at risk. Doc, your last words for today's episode.
Stroke first na can painful. So be a abufraba wa won take up kete kra even the sickle cell which mean ya stroke easily. The stroke in ya make a stroke in ya already is ago into them and mechano. Your health should be paramount than any other thing. Your health should be very, very paramount. Like take the opportunity. Go I'm in hospital. Why what can we do to all who want though? No, we are all Christians. We pray. But once a while, I call maybe a routine checkup. Maybe share me kidney, maybe share me liver, maybe a day, maybe check. You do it. Now, some of the churches, most churches are advocating.
Yes.
One of our health people, and our health people watch up with them one. No about health talk, no checkups nowadays. I say thumbs up to all these churches and even the mosque, and even in the communities.
Yes.
we should continue with. We pray that Sankofuna will boa with the funding idea. Nyankopon be boa when you come away because if you are who the way in your BP or community, or be or chapel, there will be the mosque, will be check it, will pick it the mini. So I was say like Yentuado. Then if you get opportunity, eco pharmacy, just check your BP Eba hospital. Oh, because in Eba enter main door na everywhere we have wellness center. You go there, the nurses are there. Eba be check me BP, be check me weight, be check me height. They will do it for you. It's for free. With sugar neighbor because of the strip now we using it. Then you check, you take that opportunity, you check it, then you are good to go. The may they no nowadays we should your health yama
World Cup.
on your World Cup my yama here in a stroke on the phone.
This is a World Cup between ourselves and stroke. So let's ensure that we'll be able to win over stroke and then take the trophy for ourselves.
Sure.
Right. So on this note, we are about to end today's discussion. Not to forget, we discussed about stroke, and today we had a conversation with Dr. Isaac Edujemfi. He is a medical officer at Kwesi Mintim Government Hospital. And I, your friend, am also in the person of Miss Inseido. And as always, I'm your host. And it's really a pleasure doing this with you each and every Wednesday. Yes, we are looking forward to be with you same time on Health Matters Show next week. Before I end today's episode, please and please again, the moment we see the acronym FAST, as our doctor helped us to understand the facials, the arms, the what?
Speech.
My viewers, the what? The speech. Thank you so much. And the T is the what? The time. Let's do well to visit the nearest facility and will surely be of help to you. God richly bless you for being with us. Thank you and see you same time. Bye.